We ready? Okay, good. Good morning, everyone. Welcome to the Franklin County Board of Commissioners General Session. Today is Tuesday, June 7th, 2022. As a reminder, this is a public meeting and it's being recorded. For those calling in, please ensure that you have muted your phone line by pressing *6. Thank you. We will first start with the Pledge of Allegiance. Led by myself. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. At this time, I would like to introduce our Franklin County Public Health Commissioner, Joe Mazzola. Joining him are his colleagues and fellow board members of the Central Ohio Trauma System, also known as COTS. I understand we have with us Board President and CEO of MedFlight and MedCare, Tom Allenstein, CEO of the Columbus Medical Association, Dr. Robert Falcone, COTS Associate Director of Healthcare Emergency Preparedness, Jody Keller, and COTS President Sherry Hvac. On behalf of all of the Franklin County, allow me to offer our utmost gratitude for your service and dedication to the residents of Franklin County in Central Ohio over the past several years, and especially during the pandemic. Thank you for leading, protecting, and improving the health and safety of our communities every day. Commissioner Mazzola, can you please introduce our guests and tell us more about the board's mission and share a few words about the unwavering and resilient COT staff?
Great, thank you. Good morning, President Crowley. Good morning, Commissioners, County Administration. Good morning, everyone in the room and online. I want to thank the Board of Commissioners for these few minutes here to recognize the outstanding and extraordinary work of COTS. As the designee for the Franklin County Board of Commissioners on the COTS board, I see firsthand the incredible expertise and dedication that the staff and the board have for not only Franklin County, but also for Central Ohio and Southeast Ohio, which you'll hear more about here in a second. When you think about public health preparedness, you can't separate that from healthcare preparedness. We are joined at the hip, and we are just so fortunate to have an organization like COTS to be able to coordinate our healthcare partners across our region. A lot of the headlines that we see, which rightly so, we see the healthcare heroes who have responded and have helped our community get through the COVID-19 response. They get the headlines, but the individuals that are sitting in this room and that are online really make that work happen behind the scenes. When you think about all of our hospital partners being able to coordinate capacity, and you'll hear more about that, being able to respond to other public health emergencies, this is a unique organization that, quite frankly, is not one that many communities have. And so we are just very, very fortunate, really, really proud and pleased to be able to represent the Board of Commissioners on their board. And I'm going to turn the meeting over to them here, as you mentioned. I'll go first to Dr. Robert Falcone, the CEO of the Columbus Medical Foundation, to say a few words, and then we have a few, as you mentioned, a few other invited guests to talk more specifically about the COTS mission and what they do every day. But I want to personally thank their team, and I'm just really proud and privileged to be able to be a part of this organization. So, Dr. Falcone.
Thanks, Health Commissioner Mazzola. I am Bob Falcone, CEO of the Columbus Medical Association and its affiliates. One of those affiliates is COTS. President Crowley, Commissioner Boyce, Commissioner O'Grady, I see Kevin's not here, Health Commissioner Mazzola, staff, and those online. On behalf of the entire COTS team, thank you very much. It's an honor to receive this proclamation and recognition. This year, COTS celebrates 25 years of coordination to improve the health and safety of our communities. We've grown from coordinating a trauma patient care registry and education for Columbus and Central Ohio hospitals to coordinating emergency services, trauma, emergency preparation and response for 37 of Ohio's 88 counties. We are, in fact, national best practice. More than ever, the last 2 years, the staff has been vital in providing a tool for all health systems to collaborate and provide health care in all of the 37 counties we serve. They have done this at all hours of the day and night, coordinating calls, developing new tracking systems, preparing plans, and testing those plans. The best example of our public-private partnership is the 1,000-bed field hospital at the Greater Columbus Convention Center, stood up in 2 weeks for under $2 million. Thank God we didn't need it. This field hospital could not have happened without the Franklin County Commissioners' direct involvement, leadership, and support. Thank you. We thank the Franklin County Commissioners for this leadership and look forward to continue as a valued partner in what may happen in the future. At this time, I'm going to conclude my remarks and ask Sherry Kovacs, President of COTS, and Tom Alstein, Board Chair of COTS, to say a couple words.
So good morning, and in addition to this great honor, I wanted to share with all of you, you'll be the first to know that today's an exciting day for us. We're changing our name simply to COTS, and it helps us as our mission towards the journey to diversity and inclusion for our community. As Dr. Falcone said, 37 counties. We are no longer Columbus, we are no longer the 15 central counties, and so to put that into perspective, just so you know, Crawford and Coshocton, where the Cleveland-Akron leave off, we go to West Virginia, out towards Marietta, Kentucky, and then where Dayton leaves off. So we're almost 50% of the states. We're the largest coalition here in Ohio. So we're very excited, and what you'll see before you here in a minute when we turn it over to Jody is she has some notes. Health Commissioner Mazzola did ask that we go over a brief overview of the COVID response. So she's going to walk you through a quick little journey of just the funding that you gave us, what we were able to do with it. So great. And Tom, if you have any words.
Yeah, I echo what these guys have said. Thank you for recognizing the great work that these guys and our staff at COTS do to protect the citizens and to serve all of, as these guys have said, 37 counties, which is a big task. So I thank you guys. Jody.
I think you have my slides there in front of you. That first slide is all of our COT staff. And we had to work from home for over 2 years. We had to try to find ways to remember what we all look like. So our claim to fame really is the HIL, or the Healthcare Incident Liaison. That's myself and my staff. There are 5 of us that are on call 24/7, 365 days a year. For any hospital or other healthcare organization to call us if they are in trouble or they need help. Could be an evacuation, it could be just their phone systems are down and they need us to share out an alternate phone number to call. The HIL became a direct response to September 11th, when our competing hospital programs in Columbus, they really realized that there was going to be a need for them to work together, that they were not going to be able to handle a large disaster by themselves, that they'd have to share that response. So they pulled COTS in because COTS was Switzerland on the trauma side, and they said, what can you do for us on the preparedness side? So the HIL role was formed out of that September 11th response. And what we really do is we collect and we aggregate data from the hospitals on their bed availability, their resources that they have available. We do resource allocation. We have a cache of some disaster supplies that we were able to share out to the hospitals and our coalition partners. If we don't have it, we try to find it, or we will share out the requests to the other hospitals in our zone or around the state. You know, we've been challenged with resources and supply chain issues for the last 2+ years, and every day it's something different that somebody needs. So we'll share out that to the other hospitals in the state as well. Does anybody have these blue top tubes for blood collection? And then the hospitals will just share with each other. It's really been an amazing process over the last 2 years. We do situational awareness, where we gather the information of what the hospital situation looks like. Are they on lockdown? Do they have their incident command open? So we coordinate all of that and pull that into a report. We monitor the healthcare system performance and capacity, and then we are the liaison between the region and state and federal agencies. So on the next slide, you'll see that the numbers tell the tale from COVID. On March 6th of 2020, we had our first COVID hospital call. We went into incident command a few weeks before that on February 28th, where we were aware that this bad thing was coming and we needed to get ready for it. The region became a zone. The governor pulled the 7 regions in the state and put them into 3 zones on April 15th. So for us, that was a win for us, because we were already working as a zone, because we already had Southeast and Southeast Central regions, and so we already were working together. So it was seamless for us to be able to do that. And then the zone hospitals started reporting all of their emergency department busyness into our homegrown system for hospital emergency department diversion and busyness. All of our hospitals in the zone started reporting on that February 1st of 2022, and that was a huge win. Before it was just the Franklin County hospitals doing that, but now we have visibility on everybody. So we've done a combined number of 1,185 situation reports over the last 2 years. TENS alerts was our mass notification system where we send out alerts to our hospitals or our coalition partners. We've done 7,406 of those over the last 2 years, so phones have been ringing a lot. We've held 204 surge team calls with our zone hospitals, which also included public health and EMAs. We've held 151 peer best practice calls, and those calls were pulled together with physicians to share out what they were learning, their lessons learned at their hospitals, and to share, this is working for us to treat these COVID patients, or this hasn't worked, or this is how you should give the therapeutics, or mental health resources. We've done 151 of those calls. There's been a total of 2,462 pages to the Hill over the last 2 years, and that's up by about 1,000 from what we see on a normal year. Our coalition, we do situation reports for our coalition members as well, and there's been 218 of those. And then we had over 2,000 overtime hours in the last 2 years for our staff. So then on the next couple of pages, you'll just see how that alternate care site at the convention center grew from that big open convention center space with nothing in it but the floor and the ceiling, to where the dividers went up for the rooms, for the patient rooms. And then it was a concept to operational within 2 weeks. So we got the task from the health department to go forth and make this convention center into an alternate care site. And from that day till it was ready to receive patients was 2 weeks. We were the only alternate care site in the state to be stood up and ready to accept patients. Nobody else really made it to that point, so we were really proud of that as well. Our modeling that we had very early on projected that we would see 10,000 COVID patients at our highest peak. So that's why we knew we did not have anywhere close to that many hospital beds in the region or in the zone. So we were gonna have to do something to be able to surge more patients than we had and really double the patients, double the beds that we had. So we worked on some assumptions that all of our hospitals would exceed their level 2 surge capacity, which means every bed was full, patients were doubled up in private rooms, there were patients in hallways, in the cafeteria, every available space was full of a patient, and we would need to expand beyond the hospital walls. We were gonna put stable COVID positive patients there because we didn't wanna have to find out a patient now turned positive at the convention center and risk exposure to other patients, so only COVID patients would go there. We assumed that we'd be able to have the convention center fully operational within 72 hours once we determined we needed to activate and put patients there. One of the unique pieces to the way we set up our alternate care site was each hospital system, whether it was Ohio State, Mount Carmel, or Ohio Health, was going to create their own hospital within the convention center. So we would have 3 hospitals within the convention center to form those 1,000 beds. There would be pieces and parts that they would share, like waste management and linens and food services, but their billing, their medical records, all those things were going to be separate for that hospital system. And that was really unique from what we saw from the other alternate care sites from around the country. And we really had unprecedented collaboration between the adult health systems, COTS, public health, EMA, and all of you here. We also had space for Nationwide Children's there at the convention center as well if we needed to. Part of your funding was used to hire a contractor to write the plan for how we would establish the convention center, so the concept of operations plan. That's how we used some of the funding that you provided, and we were very grateful for that because at that point in time, myself and my staff were working 17 hours a day, and there was really no way for any of us to work on writing a plan. We did have, like I said, those best practice educational work group calls. We had many calls with our chief medical officers, our director of nursing, and our CEOs from our hospitals. We talked about testing strategies. How would we set up testing sites outside of the hospitals? We talked about vaccine rollout for our staff and who would get the vaccine first in those first days. We talked about vaccine point of distribution sites for the public. Our hospitals all have plans on how they would do that for their staff and their staff families, but they didn't have plans on how they would do that for the public, and they were really tasked with doing that process as well. We talked about treatment strategies. We talked about critical surge situations. We had many, many calls on holidays, on the weekends, in the afternoon at 7 o'clock, where our hospitals, we'd have a hospital that would be overwhelmed and just completely full to the hill with multiple patients in the ER, patients in the hallways. And these were some of our very small hospitals. And we needed to have surge calls to determine how we can move some of those patients out and offload them and help those smaller hospitals be able to continue to function. We had therapeutic calls, crisis standard of care calls. We did the mental health calls. Staffing was a huge issue where we had many calls with our chief nursing officers. At the same time COVID was going on, we had also a nationwide blood shortage. So we created all sorts of strategies to be able to manage the blood shortages and how we would share blood across the hospitals if somebody had a surplus or units that were going to expire soon, we'd move those to a hospital that could use them so that nothing went wasted. Many supply chain issues, and then our hospitals were tasked with partnering with long-term care facilities to share PPE and best practices. As you know, partnerships are very important. The National Guard was extremely beneficial to us with testing and staffing, and they did clinical staffing for our hospitals. The 4 core members of our coalitions, the hospitals, public health, EMA, and EMS. Our many coalition partners, ODH, the Ohio EMA, the Ohio Department of Aging, our local governments were very important in those partnerships. The media, law enforcement, Red Cross, NORAD. Yes, even I had a call from the Surgeon General's liaison to NORAD call me one day very early in the process. So I had to make note of that one. And many, many people that we worked with and depended on that we've never met even today, that we've talked to daily and worked through with the toughest times in our careers. So we just wanted to thank you for your partnership and your assistance to us because we would not have been able to do all of this without all of you. Thank you.
You know, we've been partnering with COTS for years. It's great to, first of all, it's great to put faces with all of you. Since we've been, you know, I've been a commissioner for seems like ever now, and we've been partnering with you all along. And so, Joe, thank you for bringing, Dr. Falcone, thank you for bringing everybody in so that we can actually see the faces of the folks that we've been working with for all this time. You know, it's kind of a little embarrassing that you put that picture in there when I'm wearing the same jacket I was that day. But you know, you guys pull together partnerships, and you know, we kind of pride ourselves here at the Board of County Commissioners as being, you know, a group of folks who have the ability to pull together partnerships when we need to, and that's what you guys do. That's what you guys did in this scenario, and that was an amazing day when I went up there and you know, met with the heads of the 3 hospital systems to see them there, and all working together, all working in tandem, all, you know, ready to tackle this, all very thankful when it was over, to have seen and been a part of what you guys helped us pull together, what you guys were responsible for us pulling together. You know, we now going forward are getting ready to work with Ohio State because they're planning, now that they look at this as, you know, sort of an endemic at this point, they're looking forward and realizing that pandemics are, you know, what we live with now. And as we are, you know, whether it's monkeypox or whatever it is that's in our future, And so we are, which, who'd have thought all these years ago when I became a county commissioner that we'd be partnering with the university on pandemics of the future. But it is kind of the future that we live with now. So thank you for the work that you do. And who'd have thought when, I became a commissioner and we were partnering with COTS that, pandemics would be something that we'd be working on. But you guys do great work, and thank you for all that you do.
Yeah, I would just echo Commissioner O'Grady's sentiments and just say thank you for all that you do and all that you continue to do, and for being a partner during the pandemic. We do have a resolution, and so I know we're gonna take a picture. Administrator Wilson, I'm sorry, did you have anything you wanted to say? Okay.
It's been a long time.
Nice to meet you.
Let me balance this out.
See if I can hear it.
Ready?
Thank you very much.
President Crowley, good to meet you both.
Yeah, I remember, you brought back flashbacks.
All right. Next, we are going to, before we get to the regular agenda, recognize this month as Pride Month, or LGBTQIA Month, after an uprising that happened at Stonewall Inn in New York City, which sparked a national movement for justice, inclusion, and equality. And on behalf of myself, Commissioner Kevin Boyce, and Commissioner O'Grady, we can't say it often enough and loud enough that everyone is welcome here in Franklin County. Columbus is ranked among the nation's top 15 cities with residents who identify as lesbian, gay, bisexual, or transgender, questioning queer, intersex, asexual, pansexual, and allies. We know love is love. Many members of our Franklin County community, including commissioners, administration, and staff, will be walking with you in the Pride Parade on June 18th. Unfortunately, LGBTQIA rights have been under siege in many parts of this country, and also right here in the state of Ohio, as we saw just last week in the legislature. These attacks include Don't Say Gay legislation, where 37 states have already or are trying to restrict transgender children from playing sports. Some of these bills that restrict children from playing require internal and external genitalia examinations. As well as states that are trying to criminalize transgender affirming medical care. Equality is an inherent right for everyone in this country, and everyone is worthy of respect and kindness. That is why Franklin County recognizes and celebrates June as Pride Month. And I'm happy to come to a county leaving the legislature last year where was in committee having to question legislators who were bringing these bills, especially the ones around children and sports, and hear from parents who have children who play sports, and it's just an unfortunate situation that this is where our focus is, especially in a time where there's so many other things that we could be focused on and passing laws on to protect children, to protect our residents, to make sure that people have access to health care and mental health care and can thrive and not just survive, or don't have to worry about going to school and getting killed, or going to church and getting killed, or going to the grocery store and getting killed. But this is where we are. And, I just want to say that, however someone identifies or lives their life, has absolutely nothing to do with me. It has absolutely nothing to do with you. And we should create environments where people feel included, and that they can contribute and be a part of the fabric of the community. And if you don't feel that way, then that's on you. And it's unfortunate. But to infringe your own thoughts or beliefs on other people, and impact their way of life, it is just not right, and it's not kind. And I could say some other words, but that's where I will leave it. But I'm glad to be a part of a board of commissioners who welcomes everyone here in Franklin County. We want this to be a place where people feel like they can live, work, and play, and raise their family, and can contribute. And I'll open this up to my colleagues or administration if they have anything that they want to say, but I just want to say thank you all for your continued advocacy, for including our employees here at the county, and feeling like they can, be in a place where they're not discriminated against, and we make every effort to make sure that they have everything that they need to be a great citizen and neighbor, so not just for our neighbors, but even our employees here. So thank you.
Thank you, Commissioner Crowley. A lot of you may know that a few years back, 2013, more than a few years ago now, I was singled out by my church because I became the statewide co-chair for the Freedom to Marry Act. And so I got a lot of grief in my own parish, but also by the bishop. Was uninvited to be the speaker at my high school commencement that year. And subsequently I've taken a lot of grief for my stance on this particular issue. But stood firm because I believed that it's a social justice issue. A few years back, and I don't remember the year, but I want to say it was about 2016 or 17, Franklin County instituted a travel ban to the state of North Carolina based on legislation that the legislature of North Carolina passed at the time. And so when a lot of this came up earlier this year, but in Florida and elsewhere, I checked in with county administration about the idea of Franklin County instituting another travel ban. Then I realized that we would probably have to have a travel ban in our own damn state. So it's a big issue for me personally, but it's also a big issue for my colleagues. And Commissioner Crowley is absolutely right. It is a point of pride to be able to serve on this board, especially when you have family members that are part of the LGBT community. And so wholeheartedly and happily support Pride Month here in Franklin County. A special point of pride to be serving with Commissioner Crowley, Commissioner Boyce.
President Crowley, Kenneth Wilson, County Administrator, if I may add just a few comments. It is truly an honor and a privilege to serve in the leadership position that I serve in every day as County Administrator of a great county that has an elected Board of Commissioners, you, President Crowley, you, Commissioner O'Grady, and Commissioner Kevin Boyce. You all have always backed up your statements with action. This administration, during my time here, was one of the first to offer domestic partner benefits. And
2009.
that's a big deal. It's a very conscious board, ensuring that when we talk about every resident every day, it's backed up through our actions. You all stood up before any of the governments in the region. Were one of the first to recognize Juneteenth, which is just a few days away. You all respect history, but recognize that history wasn't always based on equity and all the things we talk about when we do the Pledge of Allegiance. But this board is, and I'm proud to be a part of it, taking actions so that the 1.3 million residents that live in Franklin County have an opportunity to live in a community that is equitable and fair and stands for justice, stands for individuals that work for Franklin County being treated as though they belong. Our Racial Equity Council of 29 or so employees, a lot of their work is grounded in belonging and allowing our employees to be their authentic selves. They can be who they are. And I believe in a time where we are working so hard to recruit employees to join Franklin County, I believe that this work is going to pay off. Word is going to spread that if you come share your talents with Team Franklin County, it will pay off for you. You will have opportunities. You will be respected for who you are as an individual, not to the extent, no one's perfect. We all on a quest to be better individuals. None of us are perfect by far. And when we identify things as an employer, we try to correct them. But we're on a constant quest to eliminate the isms, whatever kind of isms they are that we face as an employer. So I just want to add that the actions that we're able to take each and every day, and as county administrator, gives me confidence that I have a board that has my back when we're standing for doing the right thing. The first time this week to put the pride flag up is a big deal for the county. Just to show another thing that people can see that it's not just about talk, it's about action.
Light up the building.
Yes. So that's going to happen as well for the rest of this month. The 3rd through the 5th, we recognized gun violence awareness, and the building was orange. And as you know, there is so many things that plague our community, and gun violence is a crisis. It impacts and endangers the very public health of our community. Men, women, children, all types of underlying issues. So that's another area that I know this board will continue to, where we have the ability where we can impact policy to make our community safe. Thank you, President Crowley. Thank you, Commissioner O'Grady.
Absolutely, and I know we all speak for Commissioner Boyce. We try not to speak for our colleagues, but I think this is a place where we can. And Ohio is a state that does not have state laws that protect individuals from being discriminated in housing and in employment. And there is a bill called the Ohio Fairness Act that would give such protections. I also want to say, before we move on to your point, Administrator Wilson, about gun violence. So gun death is the leading, one of the leading cause of deaths among our children. And when we have these attacks on our children and, a number of pieces of legislation that prohibits people from being their authentic selves, we know that that impacts mental health. We know that there are a number of deaths by suicide that increases by using a firearm, and when people have access to those, they do use them. And that's not an urban issue. We see that in rural parts of the country, rural parts of the state, that death by suicide, by gun violence continues to increase, or by firearms continue to increase. And so I just wanted to point out how all of these things are interconnected. And no matter what people think, how we are as individuals and communities, we are all indirectly, inextricably linked. What happens and impacts one community directly or indirectly impacts another. So with that, we say thank you for your comments to all my colleagues and staff. And we will move on to our regular agenda. Ready? First, we have the coroner's office.
Madam President,
Yes.
the
Oh, sorry.
approval
Oh,
of the
I got to
minutes.
approve. We got to approve the minutes. Sorry. And
Okay, go ahead.
good.
Can I move for the approval of the minutes of the May 31st, 2022 general session and the June 2nd, 2022 briefing session?
Second.
Moved and seconded. Voting. Commissioner O'Grady.
Yes.
Commissioner Crawley.
Yes,
Thank you. The minutes have been approved.
thank you. Sorry about that. First, we have the coroner.
Resolution number 43022. Resolution authorizing the acceptance of a Coverdell Forensic Science Improvement Grant, Franklin County Forensic Science Improvement, for the purchase of laboratory supplies, offset increased opioid-related testing costs, reduce forensic toxicology backlog, and expand the testing scope in the amount of $48,249.75.
Good morning, Commissioners. Yes, we seek to have you approve a grant from the Coverdell Forensic Science Improvement Act in the amount of $48,249.75. Like it was said, it'll be used to purchase laboratory supplies, offset increased opioid-related testing costs, reduce forensic toxicology backlog, and expand toxicology testing scope. The overall result will enhance the services provided by our office to the communities of Franklin County. We respectfully request your approval of accepting this grant.
Second. Oh, I'm sorry. Move approval of resolution. I'm not used to being in person right now. Move approval of resolution 43022.
Second,
Moved and seconded. Voting. Commissioner O'Grady.
Yes.
Commissioner Crawley.
yes,
Resolution number 43022 has been adopted.
thank you. Have a great day.
I've been on camera too long.
Next up, we have the engineer's office.
Resolution number 43122. Resolution awarding contract and approving contract bond to Kokosing Construction Company Incorporated for the 2022 Franklin County Resurfacing Program in the amount of $5,556,337.
Good morning, Commissioners. Nick Zulis, Government Affairs Liaison for Franklin County Engineer Cornell Robertson. Commissioners, this resolution seeks the award of a contract and approval of a contract bond for Kokosing Construction Company for our 2022 resurfacing program. This year's program includes 23 roads, and Kokosing was awarded the contract through a competitive bidding process as the lowest and best bid. This is a locally funded project, which means that Engineer Robertson's EBE program has been implemented. Our goal was 6% for participation, but based on the utilization plan form submitted by Kokosing, we anticipate exceeding that amount. I'm happy to answer any questions and would request your approval. And Commissioner O'Grady, I can make the motion if you'd like.
If there are no comments or questions, I'll move approval of resolution 43122.
Second,
Moved and seconded. Voting. Commissioner O'Grady.
Yes.
Commissioner Crawley.
yes,
Resolution number 43122 has been adopted. Resolution number 43222. Greenman Peterson Incorporated, consulting engineers appointed to assist the Franklin County engineer in performing construction inspection services in the amount of $312,158.
Commissioners, this resolution, as the title indicates, would authorize the approval of an agreement with Greenman Peterson to assist us by providing construction inspection services. Greenman Peterson will be assisting us with the upcoming Amlin Area Improvement Project, which is located in northwest Franklin County in Washington Township and the city of Dublin. Greenman Peterson was chosen via our qualifications-based selection process. Pending any questions, I would ask for your approval.
If there are no comments or questions, I'll move approval of resolution 43222.
second,
Moved and seconded. Voting. Commissioner O'Grady.
Yes.
Commissioner Crawley.
yes,
Resolution number 43222 has been adopted. Resolution number 43322. Resolution authorizing a contract with Prater Engineering Associates Incorporated, consultant, to provide expert consulting services to evaluate the HVAC facilities at 970 Dublin Road in the amount of $8,650.
Commissioners, this particular resolution would authorize us to engage Prater Engineering Associates to assist us in evaluating our existing HVAC system in the engineer's offices at 970 Dublin Road. We anticipate needing to resize our facility, so this will assist us in that process. Happy to answer any questions, and I respectfully request your approval.
There are no comments or questions. I'll move approval of Resolution 43322.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 43322 has been adopted. Resolution number 43422, report second of the Franklin County Engineer establishing sums of compensation for a portion of the owners of property abutting the Reynoldsburg, New Albany Road at Havens Road Improvement Project, Jefferson Township, Franklin County, Ohio, in the amount of $43,976.
Commissioners, our final resolution this morning seeks compensation for 3 property owners who are abutting the proposed Havens Road, Reynoldsburg, New Albany Road improvement. That is an existing 2-way stop-controlled intersection. We are improving it with a modern roundabout, and we are improving and widening the Havens Road over Blacklick Creek Bridge as a part of that process. We did negotiate with the property owners, and compensation is based on appraised fair market value. We respectfully request your approval.
How many property owners are there?
In this project, 3, or for this resolution, 3.
Okay.
Yeah.
Thank you.
If there are no further comments or questions, I'll move approval of Resolution 43422.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 43422 has been adopted.
Thank you, Commissioners.
Thank you. Have a great day. Are you going to be with us from here on out presenting resolutions? I noticed that you've been the one lately the past few weeks.
I think so, for the most part. I enjoy coming back here. I miss it.
Good. Well, good to have you.
Thank you.
Next, prosecuting attorney.
Resolution number 43522, resolution authorizing a consultant contract with Paul Worth Associates Incorporated for public relations management and strategies in the amount of $50,000.
Good morning, Commissioners. My name is Robin Moorhead, and I am an assistant prosecuting attorney with the Franklin County Prosecutor's Office. I am here this morning to present a resolution which would authorize the board and the prosecuting attorney to enter into a consulting contract with Paul Worth Associates, Inc. As part of this contract, Paul Worth will provide public relations management and strategy services to the prosecuting attorney's office. These services would include the development of a media relations strategy for common media requests, drafting and distributing statements and press releases to the media, and preparing the prosecuting attorney's staff with strategic talking points prior to media engagements. This contract has a term of 7 months. It does not have a renewal option, and it has a not-to-exceed amount of $50,000. I respectfully request that you approve this resolution. Thank you.
If there are no comments or questions, I'll move approval of Resolution 43522. Sorry, 43522.
I'm sorry, I do have a question.
Okay.
I apologize. Why is the contract just 7 months versus just a year?
That's the term that the prosecuting attorney's office and decided it wanted for this first term, for this term.
Starting, I'm sorry, I'm trying to bring up the documents.
It would, the effective date would be today, the date of the signature.
Okay. Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 43522 has been adopted.
Next, we have the treasurer.
Resolution number 43622, resolution authorizing a contract with Huntington National Bank for depository and other banking related services in the amount of $725,000.
Good morning, Commissioners. My name is Foni Pizzanana. I'm the Chief of Financial Services for the Franklin County Treasurer. The Franklin County Treasurer's Office is entering into a contract with Huntington National Bank to provide depository and other banking-related services. The contract provides for the daily depository activity portion of the banking services for the Franklin County Treasurer's Office, along with logbook services. The Franklin County Purchasing Department has reviewed the contract for compliances to administrative requirements. The Franklin County Treasurer's Office reviewed the contract for compliance to the specifications. The term of the contract will be for a period of 3 years, beginning July 1st, 2022 through June 30, 2025, with the option to extend the contract for 2 additional 1-year periods under the same terms and conditions. The cost to the county shall not exceed $725,000 for the duration of the 3-year contract, and the Treasurer's Office recommend the contract with Huntington National Bank be approved. We respectfully ask for your approval.
If there are no comments or questions, I'll move approval of Resolution 43622.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 43622 has been adopted. Resolution number 43722, resolution authorizing a contract with Mapsys Incorporated to provide requested support and maintenance to the Franklin County Treasurer application in the amount of $110,000.
Good morning, Commissioners. My name is Dustin Cohorst, and I'm the IT Director for the Franklin County Treasurer. The Franklin County Treasurer's Office is entering a contract with Mapsys, Inc. to provide requested support and maintenance to the Franklin County Treasurer application Hvac in the amount of $110,000 for a duration of 6 months. Mapsys, Inc. is a Franklin County headquartered and state term scheduled vendor and state term schedule number of 534409-1. The Franklin County Treasurer Office manages the main operations of this agency within Hvac and ensures advancing technology is properly planned for, managed, and utilized for the benefit of the county by continuing to enhance the main application Hvac. The total cost to the application shall not exceed $110,000. We respectfully ask for your approval. Thank you.
If there are no comments or questions, I'll move approval of Resolution 43722.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 43722 has been adopted.
Thank you. Franklin County Data Center.
Resolution number 43822, resolution authorizing a contract with 3SG Plus LLC to upgrade the on-base content management system in the amount of $116,130.32.
Good morning, Commissioners. Julie Lest representing the Franklin County Data Center. This resolution is for a contract agreement with Franklin County vendor 3SG Plus for services to upgrade the on-base enterprise content management system. In addition to the upgrade, the contract includes full text search software with a price guarantee for 3 years. The Franklin County Automatic Data Processing Board has reviewed and approved this project via Resolution 22-003. Pending any questions, I respectfully request your approval of this resolution.
There are no comments or questions, I'll move approval of Resolution 43822.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 43822 has been adopted.
Thank you, Commissioners.
Thank you. Next, we have Office on Aging.
Resolution number 43922, resolution authorizing the Franklin County Office on Aging to enter into an agreement with Levy Restaurants for food and non-alcoholic beverage services in the amount of $6,200.
Good morning, Commissioners and County Administration. I'm Shonda Wingo, Interim Director for Franklin County Office on Aging. And with me today, I have our our Quality Assurance Administrator, Larice Collins. This resolution authorizes the Franklin County Office on Aging to enter into an agreement with the Levy Restaurants to provide food and non-alcoholic beverages to our senior residents for Franklin County Franklin County Office on Aging Senior Day with the Clippers in the amount of $6,200. This year marks our 20th anniversary of the Franklin County Office on Aging Day with the Columbus Clippers and the 12th year at Huntington Park. We're really excited about this being the 20th year. The Franklin County Office on Aging hosts this event every year to provide our seniors with a nostalgic opportunity to rekindle their love for baseball. We don't expect or anticipate the need to serve more than 800 seniors, and so far we've been selling, or those tickets have been selling really well, and so we expect to have a good turnout on this day. Pending any questions, I respectfully request your approval of this resolution.
There are no comments or questions. I'll move approval of Resolution happily move approval of Resolution 43922.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 43922 has been adopted.
Thank you. Next, we have economic development and planning.
Resolution number 44022. Resolution authorizing a COVID-19 recovery grant to Red, White, and Boom to promote tourism in Franklin County in the amount of $50,000.
Good morning, Commissioners. Jim Schimmer, Director of Economic Development and Planning. The resolution I present to you this morning is to authorize a COVID-19 recovery grant to Red, White, and Boom in the amount of $50,000. Historically, Red, White, and Boom brings approximately $15 million in annual economic revenue to Franklin County and the city of Columbus. Due to the effects of COVID-19, Red, White, and Boom festivities were not held over the last 2 years. And Franklin County's support of Red, White, and Boom is driven by Franklin County's interest to support the event's recovery after a 2-year hiatus, spark travel and tourism while generating sales and bed tax, encouraging residents to come back downtown and attend regional events. And for our residents, downtown is definitely open and it's ready for some fun. So with that, joining us this morning on the call is Mark McCullers. Should you have any additional question about this year's events, but pending any questions, I would respectfully seek your approval for this resolution.
Are we waiting on Mr. McCullers?
He is on the call, Commissioner, if you have any questions about the event or if you'd like him to speak.
Well, if there are no further comments or questions, I'll move approval of Resolution 44022.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 44022 has been adopted. Resolution number 44122. Resolution authorizing the Board of Franklin County Commissioners to sign the attached discharge of mortgage instrument for Walter W. Jester and Jean A. Jester at 445 Evergreen Terrace, Columbus, Ohio, 43228.
Good morning. Mr. and Mrs. Jester, they received on April 19, 1993 from Franklin County a home loan for $2,500 in real estate, commonly known as 445 Evergreen Terrace, Columbus, Ohio. The requirements of the housing loan have been satisfied. The property taxes are paid and current, and I respectfully request for the approval of the discharge of mortgage on this property.
If there are no comments or questions, I'll happily move for approval of Resolution 44122.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 44122 has been adopted. Resolution number 44222. Resolution authorizing the Board of Franklin County Commissioners to sign the attached discharge of mortgage instrument for Prater Jotevsky and Stojanka Jotevsky at 810 Erickson Avenue, Whitehall, Ohio, 43213.
Mr. and Mrs. Jotevsky received on June 20, 2007 from Franklin County a home loan for $15,000 on real estate, commonly known as 810 Erickson Avenue, Whitehall, Ohio. The requirements of the housing loan have been satisfied, and I respectfully request the approval of the discharge of mortgage on this property.
If there are no comments or questions, I'll move approval of Resolution 44222.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 44222 has been adopted. Resolution number 44322. Resolution authorizing the Board of Franklin County Commissioners to sign the attached discharge of mortgage instrument for Timothy Stillwell at 7064 Avon Drive, Pleasant Township, Ohio, 43123.
Timothy Stillwell received on July 11, 2006 from Franklin County a home loan for $1,740 on real estate, commonly known as 7064 Avon Drive, Pleasant Township. The requirements of the housing loan have been satisfied and the property taxes are paid, and I respectfully request the approval of the discharge of mortgage on this property.
If there are no comments or questions, I'll move approval of Resolution 44322.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 44322 has been adopted. Resolution number 44422. Resolution authorizing the Board of Franklin County Commissioners to sign the attached discharge of mortgage instrument for David and Beverly J. Zeimer at 1057 Columbus Street, Township of Pleasant, Ohio, 43126.
David and Beverly Zeimer received on November 10, 2011 from Franklin County a home loan for $7,849.50 on real estate, commonly known as 1057 Columbus Street, Township of Pleasant in Ohio. The requirements of the housing loan have been satisfied. The property taxes are paid and current, and I respectfully request the approval of the discharge of mortgage on this property.
If there are no comments or questions, I will move approval of Resolution 44422.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 44422 has been adopted.
Thank you.
Thank you. Have a good one. Next
You
up,
too.
Justice Policy and Programs.
Resolution number 44522. Resolution authorizing 3 sub-grant award agreements for the provision of public safety and crime reduction initiatives under the FY 2021 Justice Assistance Grant in the amount of $217,000.
Good morning, Commissioners. Courtney Benner, Grant Specialist with the Office of Justice Policy and Programs. Our resolution this morning requests your approval of 3 sub-grant awards for the provision of public safety initiatives under our Justice Assistance Grant. One award in the amount of $141,000 will be awarded to the Franklin County Sheriff's Office to hire a drug intelligence analyst for the HOPE Task Force team, who is responsible for following up with overdose survivors to offer resources, education, and access to treatment. This analyst specifically will help collect and analyze intelligence information from all 18 participating jurisdictions. 2 additional separate awards totaling $76,000 will be awarded to the Franklin County Municipal Court to support their specialized batters intervention program contracted through Equitas Health, designed to provide culturally responsive programming, and their pretrial and probation projects contracted through Alvis, designed to help reduce the length of time between placement on probation and assignment to an appropriate probation officer based on risk classification. Pending any questions, we respectfully request your approval of this resolution.
If there are no comments or questions, I'll move approval of Resolution 44522.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 44522 has been adopted.
Thank you.
Thank you. Sanitary engineers.
Resolution number 44622. Resolution authorizing a contract with Proho Enterprises LLC for the sanitary sewer connections of single-family residences in the Hvac and Brown Road East service areas, Round 2, in the amount of $511,708.08.
Good morning, Commissioners. I'm Ryan Stowe with the Sanitary Engineer. Sanitary Engineer is requesting the authorization of a contract with Proho Enterprises for our sanitary sewer connections of single-family residences in the Hvac and Brown Road East service areas, Round 2. Back in November of 2017, these areas became available for connection. In per Ohio Revised Code, each property is required to connect. Financial assistance was available to residential homeowners who meet all requirements of the program. 78 applications were received and reviewed, and of those 78, 27 were approved for assistance for this round. Proposals for RFP 2021-09-05 were received from 2 contractors on August 17th of 2021. Upon review and evaluation proposals, Proho Enterprises LLC was determined to be the lowest and best proposer. The county and Proho have agreed to a contract value of $511,708.08 to provide all labor and material necessary to connect each of the 27 homes. This contract also includes a $45,291.64 contingency. The cost of the connections will be funded by the Ohio Environmental Protection Agency and Ohio Water Development Authority's Water Pollution Control Loan Fund, whose application was approved via resolution number 164-20. The duration of the project will be 180 days, and all work will be inspected by the sanitary engineer. Pending any questions or comments, I request passage of this resolution.
If there are no comments or questions, I'll move approval for Resolution 44622.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 44622 has been adopted.
Thank you.
Thank you. Purchasing.
Resolution number 44722, resolution approving purchases for various Franklin County agencies in the amount of $946,095.63.
Good morning, Commissioners. Tracy Matthew, Assistant Director of Purchasing. And joining me is Marlise Ryan, Economic Equity Administrator in the Office of Diversity, Equity, and Inclusion. Commissioners, this resolution requests your approval of 90 purchase orders for which the County Auditor has pre-certified available funding. And Marlise has the supplier diversity data for the week. Good morning, Marlise.
Good morning, Tracy, and good morning, Commissioners. We have for your approval today 12 purchase orders presented to award to 11 women business enterprise and 1 small and emerging business enterprise, totaling a little over $184,000. The following agencies have increased supplier diversity within Franklin County: General Services, the Fleet Office; Jobs and Family Services, the Auditor's Office, Court of Common Pleas, Sheriff, Engineers, and the Probate Court.
Thank you, Marlise. Pending any questions, Commissioners, we request your approval of this resolution.
If there are no comments or questions, I will move approval of Resolution 44722.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 44722 has been adopted.
Thank you.
Thank you. Have a good day.
You too. Thank you so much. Board of Commissioners.
Resolution number 44822, resolution reappointing Paul Chodak III to the Columbus Regional Airport Authority Board of Trustees.
Good morning, Commissioners. Brittany Razek, Clerk to the Board, Director of Community Appointments. This resolution before you is to reappoint Paul Chodak III to the Columbus Regional Airport Authority Board of Trustees, and he is a member in good standing and ready to continue serving. So pending any questions, respectfully ask your approval.
If there are no comments or questions, I will move approval of Resolution 44822.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 44822 has been adopted. Resolution number 44922, resolution reappointing Kathy Collins and Molly Gautner to the Franklin County Community-Based Correctional Facility Governing Board.
Commissioners, this resolution is to reappoint both Kathy Collins and Molly Gautner to the Franklin County Community-Based Correctional Facility Governing Board. Both members are in good standing and ready to continue serving on this board. So pending any questions, respectfully ask your approval.
If there are no comments or questions, I will move approval of Resolution 44922.
Second.
Moved and seconded, voting Commissioner O'Grady,
Yes.
Commissioner Crawley.
Yes.
Resolution number 44922 has been adopted.
Thank you.
Thank you. Madam Clerk, are there any generalizations for today?
Yes, we have two. The first is case number ANX-22-22, an expedited Type 2 annexation petition, ANX-22-22, was filed with the Franklin County Economic Development and Planning Department on May 31st, 2022. The petition is requesting to annex 2.75 acres from Truro Township to the city of Reynoldsburg. The petition will be considered by the Board of Commissioners on July 5th, 2022. Site 7704 East Main Street, PID number 263-000919. And finally, we have case number ANX-23-22, an expedited Type 2 annexation petition, ANX-23-22, was filed with the Franklin County Economic Development and Planning Department on May 31st, 2022. The petition is requesting to annex 7.70 acres from Truro Township to the city of Reynoldsburg. The petition will be considered by the Board of Commissioners on July 5th, 2022. Site 755 Wagoner Road, PID number 263-001065.
Thank you. Are there any members of the media that has questions today? All right, hearing and seeing none, with no further business to come before the board, we are concluded for today. Thank you. Have a wonderful Tuesday.